Hi, good afternoon, Mr. Wayne.
Good afternoon.
Yeah, I actually come across to get to know you from Dr. Tho. You don't mind that you share, just share with us.
Okay.
Yeah.
Yes, I come here around 2019 before COVID anyways, for recommendation from a Singaporean doctor.
All right.
And the Dr. Tho was recommended for treatment of lung cancer.
All right.
And I've done treatment with him for approximately 3 years, 2 years of treatment and 1 year of follow-up from being clear from stage 4 lung cancer, so which is quite a miracle. Now I'm just following up every 6 months for a scan and a brain scan.
All right. So as I heard just now, you are actually coming here for the treatment for lung cancer.
Yes.
And do you know exactly what treatment that Dr. Tho given to you when you just come over here? And how meaning that you start the treatment? Do you have any difficulty during the treatment?
Actually, to be honest with you, I come from Indonesia.
From Bali?
From Bali, Indonesia, for the treatment. Unfortunately, nobody knows about this treatment. Another word for it is Pembro. It's immunotherapy.
Immunotherapy, all right.
Immunotherapy, which makes you don't lose your hair, or you actually look fairly normal if you take it.
Right.
And basically, it's not like chemo. It boosts your immune system to fight the cancer instead of naturally.
All right.
So
you don't have much side effect on this?
Well, the first few treatments, like 2 or 3, 4, 5 treatments, it's quite a little bit adjustment. Like you have maybe some nausea, extreme fatigue. I think because it's fighting cancer, you're getting a little bit sick before you get well.
Yes, of course. Yeah.
So, but not everybody does accept it. So,
yes, true.
But I think also you have to have a positive output on life and try not to be, thinking too negative.
Yes. And I think that over here, that under treatment of Dr. Tho Lye Mun, that you actually under very good care.
Yes, very good care.
And about Beacon Hospital, about Dr. Tho Lye Mun, that somewhere they can seek for lung cancer treatment. And I even heard that actually you have bone
cancer.
Bone cancer as well.
Metastasized, which means to be honest with you, the stage 4 is the worst cancer you can have, right?
Yes.
So honestly, your options are very small to survive. So, but today's medicine and therapies, there's quite a few more options than just one treatment. There's many options now.
Okay. And I heard just now you shared with me about your hand, that the bone inside is actually...
The bone, there was no way to operate on it because the bone was so rotten.
Right.
And so the only way to fix it was to regenerate itself. And that's another prescription from the doctor included with the immunotherapy. And so the bone is regrown itself and...
Wow, do you say that the bone is regrown itself?
Yes, regrown again,
Oh my God.
Yeah, and the ribs.
And that's the best thing, I guess.
That's amazing. Yes. Absolutely amazing, Now, I can't promise that for everybody, but, in my case, it's worked very, very well.
Okay. Yes. So it took you about how many years for the whole treatment?
Well, it's protocol, So the recommendations is 35 treatments. 35 treatments, so...
35 treatments?
Yes.
Okay, that's
over 2 years.
Over 2 years?
Yeah.
So you're doing immunotherapy, chemotherapy?
No, it's just immunotherapy.
Just immunotherapy?
Yeah, that's it.
That's it? Wow,
yes.
Okay.
But, I actually turned down chemotherapy. I just said, no, I just want immunotherapy.
All right. So you just go ahead with immunotherapy?
Yes.
Okay.
Yes. So, And now this is, my last treatment was in December 2021. So now it's August 2022.
All right. So today you actually coming back here for follow-up only.
Yes.
And you had your latest report on the PET scan?
I do.
You don't like to share the results, huh?
Well, I really can't read it. I'm sorry, because the doctor.
The doctor's going to read it.
The one thing about the doctor has told me, if he talks to you a long time, then you should worry. If he just says that everything's okay, then it's okay.
All right. So just now you met Dr. Tho already?
Yes.
So he explained to you that everything is okay?
Yeah, he just said it's good news today. Congratulations.
Wow, that's good. Yeah, that's really the best news that we can get as a cancer patient.
Basically, every time when you're getting checked, you're kind of always thinking in the back of the head, maybe it's still lingering around in the head. I'm not saying that it can't come back. Of course, you have to change your lifestyle too, you know what I mean?
Yeah, just have to still discipline yourself.
Yes. Change your diet.
Your lifestyle. Yeah.
Cut smoking. Drinking.
And living in Bali is always good, huh?
Yes.
So you enjoy your time right now in Bali.
Yes.
And with a peace of mind, and always come back for follow-up.
Yes.
Yeah.
And these people, like the receptionist, Miss Shanti, is it? Takes good care of you when you
come
have to
over.
come here, you know.
All right.
So,
so meaning that even the staff here, they are very friendly.
Yes.
Yeah.
They look after
They're
you.
assisting you. They are looking after you well.
Yes.
So anything that you want to share with the community out there, especially maybe to some other cancer patient that maybe they are afraid to seek for treatment.
Yes. What I found was this. We need to get the word out that there's options for people for treatment for all types of cancer. And in Malaysia, the Beacon Hospital, I highly recommend it because it's been very good service to me and taking good care of me.
Anything about Dr. Tho Lye Mun?
Oh, Dr. Tho?
Yes.
Well, Dr. Tho, he's a very busy man, so I can't say for all his things, but he's got tremendous amount of patience, and so far he hasn't put me in the wrong direction and, led me to recovery. So, highly recommend it. I actually recommended 2 patients this week from Bali.
All right. Thank you very much, Mr. Lane.
Yes.
Thank you for having your time with us.